Come in.
I'm washing my hands. Hi, Mr. Hoffman. How are you?
I'm doing well, thank you.
My name is Nancy. I'm a nurse. I'm going to be doing an assessment of your belly.
Okay.
All right. I'm going to start out by asking you 2 questions. Are you over 50?
Yes, I am.
And have you had a colonoscopy screening for cancer?
Yes, I have.
Oh, good. That's an important preventative care measure to take. And do you have any history of problems with your gut or your abdomen or your stomach, ulcers?
No, I don't.
All right. Okay, so I'm going to start by looking at your belly. So I'm going to look from here, and I'm looking at the contour, which is the fancy word for shape. And your abdomen is a little rounded. And then I'm going to come down here from the foot of the bed and look for symmetry. Both sides should be the same, which they are. And then I'm going to come back here and I'm going to look at your umbilicus, or commonly known as the belly button, and looking for any lesions or any problems or any skin discolorations, or many young people have a piercing here, so you would want to note that. And then I'm going to look at the abdomen overall for skin color and any lesions. This is a common place for moles. And so we do look at moles as part of skin assessment, but also part of the abdomen, that you would be looking at the skin for anything abnormal. And then also I'm looking for movement. I should see normal respiratory movement of the abdomen, which I do see. And also right here in the epigastric area, many times you can see the pulsations of the aorta. That is a normal finding and is seen commonly. Some people you can see it, some people not. Usually in thin people, it's visible. And I do see the aortic pulsations here, and I see the respiratory movement, that's normal. I do not see any waves of peristalsis. That's uncommon to see, but you do want to look for that. And then I'm going to move on to auscultation. When we do assessment of the abdomen, we do auscultation after inspection, prior to palpation. I use a diaphragm of my stethoscope, and I make sure to listen in all 4 quadrants. And what I'm listening for is vowel sounds. Vowel sounds are kind of tinkly sounding. So I'm listening in all 4 quadrants. Usually you go around like a clock. You can start in any quadrant that you want. And when you listen to vowel sounds, you would need to determine, are the vowel sounds normal, or are they hypoactive or hyperactive? This is something that you will learn as you listen to more abdomens and you train your ears to hear vowel sounds. It's very difficult to count vowel sounds and to have a very specific number that equals hyperactive as opposed to hypoactive. So this will come with more experience. Then we're going to move on to palpation. So we start with light palpation across the whole abdomen. You want to cover the whole abdomen. And usually, again, you go on a clockwise method, but you want to make sure that you cover the whole abdomen. So I'm going to start by just pressing down about 1 inch and using a rotary motion and all over the whole abdomen. And Mr. Hoffman, let me know if there's anything that feels tender. And is there any area of your abdomen right now that's bothering you that feels tender or painful?
No, not at all.
All right. So if there was an area that was tender, you would want to save that for last. If you palpate the tender area first, you're going to be done with your assessment because the patient will be not happy with you. Okay. So now I'm going to palpate your abdomen a little. I'm going to press a little bit more this time, so you're going to feel a little bit more. So now I'm going to press in about 5 to 8 centimeters. So sometimes this can be difficult. People can kind of tense up the abdominal muscles as you're doing this. Maybe it feels a little uncomfortable or they're a little bit ticklish. So you want to try to help your patient to relax while you're doing this. So you just want to make sure you cover the whole abdomen. right, well, wonderful. Any questions for me?
No, again, I felt no pain on that second time.
Okay, good. All right, well, that concludes the assessment of the abdomen.